Hi, this is Dr. B with your Emotional Minutes, and welcome back. Today we're talking about anxiety disorders, or just high levels of anxiety in general. And anxiety can be a really difficult thing to deal with. And sometimes people will ask, how do people get anxious? Or how did I get anxious? How did I get to this point? And there's a number of ways that can happen. Today I'm just going to talk about a couple general sort of ways and kind of common ways that people can come to experience anxiety or certain types of anxiety disorders. And first, I want to say that a certain amount of anxiety is actually pretty normal and is actually okay to experience, because really what it does is it kind of cues us to action when we have a certain task to perform. Really, when we talk about anxiety as being more difficult, is really when it starts to cause problems in people's lives. There tends to be a lot of different types of anxiety. So things like certain phobias, where people are really extremely afraid of a certain particular thing, or social anxiety, when people have kind of fears and thoughts of being judged in social situations, and some negative social outcome happening because of that. Or generalized anxiety, where people just experience a lot of worry about a range of different topics. There do tend to be some sort of general common factors or general common conditions in people's lives that can contribute to them developing anxiety disorders. One of them tends to be what we call avoidance. Avoidance of things that might be sort of scary or fear or anxiety provoking for people. So oftentimes, if you're constantly avoiding something that you might be afraid of, it's kind of nice because at first you get some relief. You don't have to contact that thing you're afraid of. But then what can happen over time is that the more and more you avoid it, you just kind of never get a chance to sort of prove to yourself that that thing you're avoiding might not necessarily be harmful. Now, sometimes there are things in life that actually are harmful, but sometimes we might convince ourselves that something is harmful, and we never get a chance to sort of disprove that. So one example of this might be, someone with, say, a dog phobia, a fear of dogs, might actually continue to avoid dogs. And if you've seen dogs, some of them, every once in a while, you might encounter one that's not very nice and maybe kind of threatening. But oftentimes you also encounter a lot of dogs that aren't threatening. But with a person who continues to avoid, they never get a chance to kind of prove to themselves that dogs might not inherently be harmful to them. So the second kind of most common way that people might develop anxiety or an anxiety disorder, again, concerns thoughts or beliefs. Oftentimes people will come to start to be anxious about something because they've kind of started a pattern in their lives, or at some point a pattern in their lives, kind of starting to interpret situations, and especially situations in the future, upcoming situations, with some sort of sense of dread or catastrophe, or assuming that the worst thing or a really bad thing is going to happen in a situation. So, for example, individuals who experience social anxiety will often have a continued kind of thought or belief that anytime they go into a social situation, then it's going to go bad, or something bad is going to happen, or other people are going to judge them or laugh at them, or things like that. But really, you can see how this is sort of a thought or interpretation process. And those thoughts or beliefs can sometimes be connected with avoidance, because if you're really believing that something bad is going to happen, you might avoid that situation. And then there goes that process of, when you avoid, you never get a chance to kind of prove yourself wrong about those things. Sometimes those really interact with each other and can occur along with each other as well. So usually those are kind of two key ways that people come to experience anxiety. And if you think you're experiencing these things and it's really bothering you and it's creating a lot of problems in your life, then sometimes people will kind of start to get into certain patterns or try to break those patterns. So say, for example, if it's avoidance, they might try to avoid things less, or kind of what they call lean in, try to do things that really are outside of their comfort zone, but help them sort of disprove that those things might be harmful to themselves. And then other times people might, kind of like we talked about before, they might use cognitive reappraisal. Again, just a fancy word for they might try to check in with their thoughts and try to think differently about situations, or evaluate or interpret those situations differently. And again, if you're experiencing a lot of difficulties with these things, I always recommend contacting a mental health provider. Today we talked about a couple kind of common ways that people can get to experience anxiety. And again, I'm Dr. B with your Emotional Minutes, and we will see you next time.